Welcome to our second session of 5 in the COG Quality Infrastructure series. My name is Jennifer Wagner, and I'm the Director of Rural Health Initiatives at Convergence Health. I like to tell people I get my rural health cred by growing up in rural eastern Montana, and I can continue to live here in Montana. My past experience working with Montana Critical Access Hospitals. So for anyone that wasn't able to join last week, I want to give a quick background to the series. In March 2023, National Partners for the Rural Hospital Flexibility Program convened a group of cost state flex programs, hospital and healthcare association staff, and several quality consultants and quality program subcontractors for the purpose of identifying what are attributes of a strong quality infrastructure in critical access hospitals. I was incredibly honored to be included in this group, and I want to really make sure credit is given to the Federal Office of Rural Health Policy. They fund the FLEX program, the FLEX monitoring team, the National Rural Health Resource Center, and Stratus Health. These organizations have worked to develop such a well-informed and valuable resource and data source for rural hospitals and programs that support them. These people, they really do understand and care about rural healthcare quality. We will provide links to the full report for you to read in its entirety, as there is some detailed information on the quality infrastructure and context to each element and the process as a whole. And as a note, while you see COD noted throughout the report and the assessment, this content really applies to any rural hospital quality program. So our objectives today, we're going to go over the data from the COG Quality Infrastructure Self-Assessment, looking at out of the national outcomes, how are these two elements we're talking about today score and how the criteria for each scores. We're going to talk about each criteria to meet the elements, and then I want you to be thinking about one intervention that might get your own hospital closer to meeting an element or meeting a criteria that you can start working on in your facility. So today we're going to be talking about the elements in orange, quality embedded within the organization's strategic plan, and workforce engagement and ownership. These elements score relatively low, so I hope after today you leave with some understanding of what the elements mean and the purposes and ways maybe your hospital can meet the criteria of these elements and strengthen your own quality programs. As we go through the elements today, I'll be encouraging some chat conversation. This is a great opportunity to ask questions and network with your peers on the call. You never know who may be meeting these elements that have a great idea and have something they can share that's done, or anything that they've learned. We really believe here at Convergence that our experiences and stories truly help each other. And by sharing those and networking with each other, we're going to raise all the boats. So please don't be afraid to go in the chat. And if you want to unmute and interrupt me, I'm happy to take interruptions. So just a reminder that as we go through these elements and their criteria, that they'll be really naturally nuanced in your state or your hospital. And our intention with this series is to give a broad overview of the elements and ways to meet the criteria. So again, for each core element, there are 2 to 4 criteria that list ways the element can be met or demonstrated. And to meet an element, a hospital must meet each criteria. So this session, we're going to talk about the first, our first element here, quality embedded in the organization's strategic plan. So this means we want to ensure that quality is an intentional component of the strategic plan, and not just of the plan and the planning process. So it's kind of interwoven within everything. We saw in our national data a little over half, 59% of hospitals completing the assessment met this element. As a note on this, sorry, I got ahead of myself. So our criteria for this element is criteria number 1, quality leaders participate in organizational strategic planning. Criteria number 2, quality is a core component of the organization's strategic plan. And criteria number 3, quality is reflected in all core components of the organization's strategic plan. And you can see on the slide that each of these individual criteria they score higher, but meeting all the criteria, but meeting each one of the three to meet the element is not as high. So we're going to spend a good chunk of our time on criteria 3, the qualities reflected in our all core components of the strategic plan. This is the lowest scoring criteria of this element. And I think this is a great reach goal to think of as our quality cultures are starting to evolve in the healthcare sector, where we can see ways that we can really incorporate quality into all components of the strategic plan. So if you were with us last week, you saw that each criteria had kind of like a checkbox list of ways to meet that criteria. For this element, it's all yes or no. There's none of those little sub ways to meet it. But we'll be talking about the whys behind each. And I want you to please share comments and stories, questions, ways you might meet this criteria in the chat as we go along. So criteria number 1, quality leaders participate in organizational strategic planning. I want you to consider a couple things. First, look at this list of 10 essential issues for cost to address in strategic planning. It's actually from an article titled Accelerated Strategic Planning for Rural and Critical Access Hospitals. If you want to dig more into the article and learn more about this for your facility, I have it linked in the resources. But let's do an audience participation. So as I read through these areas that we want for hospitals to address in their strategic planning process, I want you to put the corresponding number of each issue in the chat if you feel it is an issue that the quality leader should and has value to participate in. So number 1, quality of patient care. Issue number 2, physician retirement, recruitment, retention, engagement. Issue number 3, broad access to primary care and specialty service. 4, service line enhancement opportunities and niches. 5, revenue growth, expense control. 6, patient and family experience. 7, independence and alignment due diligence, anticipating future needs. 8, board member and C-suite succession. 9, culture of excellence and accountability. And 10, philanthropy. So of these strategic planning issues, or you could even call them components, what areas is it valuable for our quality leaders to be engaged in? Paul 169, great, yep. Leslie is number 1. One nine six. Oh, 1-2, yeah. Pamela, yay, all of them. I love that. Yes, Heather, caught number 4 for sure. 1, 2, 4, 8, 9. Awesome. So you see there's so much that we do in strategic planning that our quality leaders are so valuable in. Oh, I love the ones that say, "Oh, yes." Absolutely. Awesome. Thank you guys for participating. So I just wanted to, like I said, I wanted to point out that there are ways that we approach strategic planning that really the quality leader is instrumental in and should be included in. Secondly, I want to point out the alignment of the strategic planning process to quality improvement methodology. So QI leaders are the experts here. You guys provide valuable experience in this process of basically defining a goal, identifying what we're going to be doing, measuring if we complete it, and that whole project management and quality improvement methodology is very much in alignment with the strategic planning process. Criteria 2, quality is a core component of the organization's strategic plan. So I want you guys to think, does your mission or vision mention quality? This mission and vision up here is, any of my Montana people from Plentywood might see it familiar. It is Sheridan Memorial Hospital Association's mission and vision, providing quality care to improve the health and well-being of the people and communities we serve, and shared and memorial endeavors to be a leader and innovator in providing high quality, cost-effective healthcare services. And when we consider that healthcare strategic planning is grounded in an organization's mission, vision, and values, and your mission, vision, or values reflect quality, then quality should be a core component of your organization's strategic plan for sure. Criteria number 3, quality is reflected in all core components of the organization's strategic plan. So we want to see quality as a core component on their own, but we also want to see it interwoven and reflected in all the core components of an organization's strategic plan. And this sometimes looks like I mentioned, this is the reach goal, right? It sometimes gets hard to see where we can align quality in finance or quality in operations. But we'll go through 3 of the more common strategic plan components and talk about why implementing that quality lens is important within those. So first, financial stability. So financial stability, I think, is a must-have component of every organization's strategic plan. And so how does finance and quality intersect? I want to share an example I found in a May 2022 OIG report. They found that a quarter of hospitalized Medicare patients experienced some sort of harm in October of 2018. And then a quarter of those harm events resulted in extra costs to Medicare, and then 43% of the harm events could have been prevented. So these costs are easily incurred also at the hospital level when harms occur. And I know, like I always say, the finance piece of quality is kind of icky, and the finance piece of healthcare seems icky because we just want to provide care and help people be healthy. But if we don't realize where we're having costs that we don't need to have them and that could be prevented, it not only monetary and harms to patients, we look at the risk of closing doors. So we still have to stay open. I've included an article for reference in the resources, but Joseph Pfeiffer, the president and CEO of HFMA, or the Healthcare Financial Management Association, and Stephanie Mercado, who is the CEO and executive director of the National Association for Healthcare Quality, or NAHQ, actually wrote a great op-ed on strategic relationships between quality and finance. And over the next couple slides, I'll share some of their thoughts and quotes from that article. But in regards to finance specifically, they believe quality should be seen as a catalyst through which all other initiatives can thrive and financial pressures can be relieved. And there's data that shows that higher quality care is clearly more cost-effective care. So quality absolutely has a place in our financial stability. Population health is another core component of a hospital's strategic plan. When quality improvement is integrated into population health work, we see gaps closing for those in need. Pfeiffer and Mercado also said that quality improvement initiatives must also encompass health-related social needs, factors that affect people's ability to maintain their well-being. So having the quality lens where we're looking at making an improvement, not furthering any gaps, is really important to bridge the gaps in population health as well. Workforce is another core component of many strategic plans. Having quality as a component of your workforce really accelerates improvement efforts and gives staff a sense of purpose, ownership, and satisfaction in their work. Dr. Deborah Sowell is a nursing professor at Southern New Hampshire University, and she points out and reminds us that healthcare quality improvement is the job of everyone. And you'll see this in everything we talk about here at Convergence, through this series and others, that it really is everyone's job and a piece of everyone's job. She continues, regardless of the role or position in a healthcare organization, everyone can be a quality safety advocate, and each discipline has a collaborative role or a seat at the table of safety and quality, as each views healthcare delivery different through a different lens. So those perspectives are so important. And this is a great segue into our second element of the day, workforce engagement and ownership. We want to develop and support a workforce that embeds quality in everyday work. This is another piece, I think, of that culture of continuous quality improvement and quality cultures that is starting to evolve more and more into healthcare. And it's really exciting to see. But 61% of hospitals completing the assessment can demonstrate meeting this element. So our core criteria of this element, we have four. The first, the organization has formal onboarding and orientation that embed quality as a priority. The organization has regular ongoing professional development opportunities for staff related to quality. Quality improvement is incorporated into standard work. And the final is the organization embeds diversity, equity, and inclusion in workforce development. So these elements or these criteria on their own for this element score really high. And so we're looking at gaps like maybe where are some of, where are you maybe not meeting an individual criteria to meet the whole element. And we'll talk about ways that we can start looking at that and building our workforce support. So criteria number one, the organization has formal onboarding and orientation that embeds quality as a priority. So employee onboarding to quality should include the quality methodology the hospital uses and how to use it. Some hospitals may use Lean, some may use PDSA and the model for improvement. Some may use Six Sigma and DMAIC. So you want to, when staff come on board, and if we're talking about everyone has a seat at the table because everyone has a different perspective, we want all staff to understand what our quality methodology is in the hospital and how we're going to use it. The quality plan and how their specific role integrates. Again, the quality plan encompasses all service lines and departments within the hospital. So there is not a staff person that you're onboarding that should not be aware of what the quality plan looks like. And quality metrics, especially for their department or service line, those metrics that they're working on for QAPI, they should be oriented to. Criteria number two, the organization has regular and ongoing professional development opportunities for staff related to quality. So in the chat, I'd love to hear, we'll go over some on this slide, but I'd love to hear what professional development for quality leaders and other staff do you do in your hospital, whether it be in services, but is it meetings, paying for education, etc. So while I'm going over these, I'd love to hear what your hospital is doing in the chat. So the organization can support staff members obtaining credentials. We find this is really a valuable piece to validate staff's commitment and their knowledge in quality improvement or other areas. Some examples include the CPHQ, which is the Certified Professional in Healthcare Quality, CPPS, the Certified Professional in Patient Safety, the Certified Professional in Healthcare Risk Management, or CPHRM. All of these are really valuable credentials that help validate and further ground that information or that experience within your staff. You can have a book club or literature reviews. Choose a book or an article to read together and then discuss for 5-10 minutes during quality meetings. Atomic Habits by James Clear is a favorite of mine and really closely aligns with quality methodologies. Right now, I'm reading the influencer model, and that is really amazing. I'm through like the first section is all, but find it so helpful. So these kind of books are really helpful and easy to read, and it's kind of fun to ping ideas off of each other. Oh, Leslie, I'm glad you love Atomic Habits. James Clear is awesome. I'm like, he could teach quality improvement for us all. And then mentorships. Can you partner quality champions in your hospital, people that are in different departments that are like minds and support quality improvement? And are there opportunities through health systems or other hospital networks within your state? I know in Montana, we have the Performance Improvement Network where all the hospitals are able to network with each other. And those that have been in their role a little while longer can help mentor and support those that are new. So there's a variety of ways to get this or to support these opportunities and help embed quality into everyone's job. Criteria 3, quality improvement is incorporated into standard work. So the assessment does provide ways to meet this specific criteria, and they include integration of quality into daily rounding practices. Our quality leaders and part of the daily rounds. Leadership is seeking staff feedback related to quality daily, how things are going, what can we do to change. And then recognizing high quality performers and celebrating wins, at least on a quarterly basis. Some can do more, but I feel it's really important to celebrate each win, each milestone, um, because it gives us the energy to keep going, and it helps staff stay engaged in what we're doing. The fourth criteria is the organization embeds diversity, equity, and inclusion, or DEI, in workforce development. So the assessment provides ways to meet this criteria, and it includes comprehensive health equity training incorporated into staff onboarding training and or ongoing annual staff training. Um, and while we're on this one, I'd love to know in the chat, does your hospital have like a health equity training curriculum? What do you guys use to understand what health equity is? And if there's like a specific product or a specific curriculum, we'd love to know, as others might be wondering. Has the organization implemented a DEI plan? Is staff diversity reflective of the community, including leadership? And does the organization collect feedback from staff regarding inclusivity and belonging, and then uses that feedback for improvement? So I have a quick poll here. Don't worry, we're not going to go over, I promise you. And I am wondering, has your hospital started DEI work? And what does that look like? So I have these options that I just read off on the screen. Just curious where everyone is at, as this is also kind of that new evolution into really looking at impactful ways to improve health. And if your hospital hasn't started, that is okay. We just love to know where everyone is at so we can meet you where you're at. I really think Zoom should just automatically play music while polls are going. But don't worry, I won't sing or anything for you guys. I'll close the poll when we get half. We have 26 of 53 participants responding. There we go. Okay, what do our poll results look like? So we have the majority of people have implemented a DEI plan at their facility, and have comprehensive healthcare or health equity training. So this is really great to see the approaches that people are using and organizations are using to start to embed diversity, equity, and inclusion. And I know this is really hard in rural, because rural is usually not very diverse to begin with. So just know we recognize that and we are here to support that. So thank you guys for sharing in the poll. So before we leave this element, I want to share some really quick thoughts on engagement, because when we talk about workforce, embedding quality and engaging, we're talking about relating to people. So when we look at engagement, the why matters. You are really selling either a culture or an idea. And I love the comment from Simon Sinek, who says that people don't buy what you do, they buy why you do it. So understanding your why, understanding others' whys will help embed quality and get people engaged in quality at the workforce level. Connect with stories. You can use stories to build anything and get people on board. That is what people respond to. Understand your people, understand your colleagues, their personal learning and communication styles. There are lots of tools out there. There's Myers-Briggs, there's DISC assessment, there's influencing models, there's models for change. So dig in and kind of learn about the people you are around. Make sure you set realistic expectations. I'm a big fan of realistic expectations. So we want to approach improvement with incremental change. So yes, maybe we're at 50% in this measure and the big goal is 100, but we're going to start with our first goal being 60%. Then we're going to increase that to 70%. We want our goals to be attainable and achievable, so that we don't get discouraged along the ways. And go to the Gemba. I like saying Gemba, so we'll keep that in there. Gemba is a Japanese term for actual place, and it is used in lean methodology. And it just means that we want to involve staff doing the work where the work takes place, and ensuring that our processes are designed to make it easy to do the right thing and going to our staff for those solutions. So I will open it up for any questions. Feel free to unmute or put in the chat box, or any discussion points you might want to make. And if while anyone's typing, there will be an evaluation when you exit the call. So please complete that so we can know how we did and how we can improve for the future. Zoe, can you explain the DEI requirement? I'm going to go back. So it's ensuring that, so criteria 4, embedding diversity, equity, inclusion in workforce development. So that's making sure that as we're building our workforce, that we're recognizing diversity. We have ways to make sure our staff is diverse. A lot of data has shown that when people see themselves in a provider or in the staff, they're more comfortable. And there's various ways to do it. There's training, there's plans if you want to dig in. Like I said, I know in rural it's really hard to have a diverse workforce. So it's difficult. I know that. But there's different ways we can do it and different ways we can look at attempting to do that, and training, workforce, and then getting feedback from staff. So that wasn't my best explanation. If so, Heather put in the chat, if any, Zoe, yes, I would say that counts. Yes. If anyone has a copy of their DEI plan, I'd love to see it. If you have a DEI plan, if anybody does, I would love if you emailed it to me. I can share it with the group. Let me know if you want it de-identified. Whatever works, but we're happy to share that so others can see, and we appreciate any sharing of that information or those plans.
Not a requirement, a question, Jennifer. This is a requirement. How is it? Is there somewhere we have to input that we're taking care of this? Is this just if a surveyor comes and asks to see the plan?
Oh, it's not like Nikki, it's not like a regulatory requirement. It's just it's just a piece of this infrastructure. So if we're looking at what shows a strong quality infrastructure, we want to make sure that these pieces are also part of our workforce plan. And so you don't have to, this is all like self-assessed, self-documented and self-reported. So you don't have to report it anywhere. But they're just different ideas on ways that we can help build that quality culture and start beginning to strengthen equity and diversity in the workforce also. So there's no regulatory requirements there.
And this is great. We've recently just started trying to tackle this problem. As you said, the rural communities is mostly pretty not very diverse. However, we do get those occasional people coming in, and this would be great, just education. So I can take this to my CEO and tell him this is why we need to start doing this. So this is wonderful. Thank you so much.
Yes. And there is different ways to look at diversity too. So I encourage you to dig into that. It's not just like race and ethnicity. We can look at diversity in the people, like there's diversity in income levels, and like where Nikki lives, there is diversity in where people work. You have professionals, you have a logging industry. There's a lot of different ways to look at diversity other than race and ethnicity also. So yes, veteran status, that's a great idea. Thank you, Sarah. And Samantha comments, if you are Joint Commission accredited, a DEI plan is required. Awesome. Oh shoot, we're a minute over. So our next session is in 2 weeks, or is next week, May 2nd, continuous improvement through behavior in systems. And we'll send the recording and the slide deck. Please complete the evaluation when you're done, and happy to answer any questions at any time or have a conversation and talk things through. So thank you all for your time. Sorry I went over, but I hope you guys all have a great day. We'll see you soon. Bye.